I am Rachel Kilgore, and I am an AHEAD patient. My husband and I have 2 children. We have an 8-year-old boy and a 3-year-old boy, and they are a handful. They're hilarious, just such active boys. And our days are busy from 6 a.m. to 8 p.m. every single day. School, work, going to the gym, after school activities, church activities. My sister got diagnosed about 3 years ago, and I was living in Missouri at the time, and I contacted my OBGYN there, and she had said, "No need to test you, you're young." We moved here, and I saw Dr. Westgate and tell her the story, and of course she, right away, she said, "We're testing you today," and diagnosed that same month that I was positive for BRCA1. It became very real for me as I had my my breast MRI, my first breast MRI, and they found something. Oh, they found something. So they followed up with a mammogram and an ultrasound that both come back negative. But that takes a while for both of those studies to come back. And so for a few weeks there, I was thinking that I had breast cancer, or potentially had pre-breast cancer cells or something. And coming back negative was the biggest relief. But then that feeling was still there of this time they came back negative. What about next time? The percents that I was looking at for risk of breast cancer was 87%. I'm not fortunate enough to be in that 13%. I know that from my life, that the chance of me being in that 13% was very low. So 87% spoke very high. When I found out I had the BRCA1 diagnosis and talked about it with my husband, he's very supportive of the surgeries. He does internal audit. He's got this very analytical mind. It's all about mitigating risk. To where when I told him about it and told him about the options, his exact words to me were, "You'd be stupid to not have the surgeries." It was just kind of a blunt thing for a husband to say, but he was serious in that he was fully supportive of the surgeries if it meant that I would be around to see our kids grow up. I have found that the information that providers seem to have about the BRCA gene and treatments is varying throughout the country. They don't all know the best practices. And I was very fortunate to find Dr. Westgate, who is on top of it. She knows, and she's educating her patients and trying to do what's best for them. Having the knowledge, it gives me another thing in my toolbox of preventing future cancers. I've already taken care of breast, ovarian, and uterine cancer. There are other risks, but I know to look for them, and my doctors in the future, as I get older, will know to keep an eye out for them and do screenings. And that knowledge really is power. Really, the decision to do the combined procedures, I knew I wanted to have it all done. So then it's, do I have it all at one time, or do I split it up in a couple of surgeries? And for my family, for my work, for my mother being available to come and help out with the family, it just made sense to do it all at one time. And that was one thing that Dr. Westgate had stated as a possibility. And that was the decision I ended up making, because it would be a shorter time away from work and less of an inconvenience, you might say, on the family life. It took me about 10 to 12 weeks to really get back to, say, my baseline. And now 4 or 5 months out, then occasionally I'll have some weird sensation or numbness, but everything is back to really my normal. I'm back exercising and doing everything that I was doing prior to surgery. Knowing I had a very experienced team of surgeons, and so many surgeons, was amazing. It really helped make me feel comfortable. I knew I had people who were up to date on the latest and greatest technologies and best practices. For women going through that, I would just say it's worth it. I don't regret it. I would not go back in time to change it. I would do exactly what I did.